It's very difficult for them to even actually imagine that on the second day after surgery, they're already doing their exercises, walking, and they have to go to the gym. In Nigeria, they have to go to the gym on day 4.
Many Malaysians still fear of the heart surgery. Although, I mean, like now you have mentioned regarding it's actually faster. I mean, the teams are much more well equipped, I mean, they have we have advanced in terms of now we have the enhanced recovery after surgery. But some of them are still worried because they feel that surgery is the last resort. So how do you actually reassure your patients? Because sometimes some of them are still reluctant. They keep on coming, giving TCA again and again, but they still haven't come up with the decision for surgery.
Well, actually, the most important thing that, as you know, is explaining to the patient, right? So most of the time, they think that after cardiac surgery, they will be bedbound for weeks, and they cannot do their daily activities. So when you explain, it's very difficult for them to even actually imagine that on the second day after surgery, they're already doing their exercises, walking, and they have to go to the gym. In Nigeria, they have to go to the gym on day 4, right? So they actually go down from the ward to the gym, do their treadmill, or they do their cycling, especially, right, exercise. And it's a requirement. So when they hear that, then they realize that, hey, wait a minute, this is almost like nothing now. You know what I mean? Of course, there's risk, and we will always explain the risk. There are some patients that are low risk, there are some are high risk. Some patients would not be able to have a quick recovery. We know, especially those with a poor heart or many risk factors. But in essence, when we explain to the patient, and in Nigeria we have what we call a pump talk, if I'm not sure you remember. So the patients will be shown videos of how the recovery is like and how the ICU is like. So when they see it, they have an understanding of what happens to them.